chest physical therapy?
So yes, I did actually have chest physiotherapy on that regard. I think within the context of therapists supporting a family, an assessment by a physiotherapist with regard to helping a family. This is a different situation to a child with cystic fibrosis where there is an active lung process going on, but certainly teaching a family techniques of percussion and posturing, positioning of a child with regard to postural drainage will certainly be of benefit, and we always valued the assessment from them.
I think just to reinforce what you said, the basic problem here is it comes back to what we've said, that the muscles that coordinate swallowing that normally deals with this quite a large volume of saliva we produce every day. We're not aware of it because we're continuously and subconsciously swallowing this. But if you can't swallow normally, then this saliva is going to pool in the back of your throat. Some of it may spill over and go down the windpipe into your lungs, which could cause pneumonia, or it comes out of your mouth as drooling. So that's the basic neurological problem behind all of this. Because you have difficulty with coordination too, it may be that not only are these liquids getting into your lungs, you may have trouble coughing to clear it. Because normally when you cough, you take a deep breath in, and then you actually contract the diaphragm. There's a tremendous velocity of the air that's passing out. It creates these so-called shearing forces and helps move secretions, even if they're sticky secretions. But you can't do that as effectively if you can't coordinate movement. And so that's why physical therapy is important, because it's replacing those normal mechanisms. As Julian said, you're going to put people in position to help drain these secretions away so they don't go into your lungs. The idea of physical therapy is that you're using vibration techniques and percussion, you're banging on the chest to help move these secretions and to keep the lungs and the airways open. And so bronchodilators can help that as well. But again, we don't have formal studies that we've done in this disease, but it's standard of care, and I think it does help. Enid, did you want to make a comment?
Yeah, I just wanted to be sure that parents were informed of the Heimlich maneuver and knew how to apply it, because we had to use it many times for my son.
You want to explain the Heimlich maneuver?
Yes. So, So the Heimlich maneuver, Dr. Heimlich, I'm not sure what this is, it's a standard exam answer of a physician at the turn of the century, but is a maneuver in choking, in the management of choking, and from an adult perspective, it is getting behind the
I'll be the choking, so
okay, it is getting
sorry.
It's getting you're holding your fists together there and upward and inward and upward under the chest, under the rib cage, can often help dislodge in that end. From younger patients, there are a number of techniques of a good slap on the back there, and then a more of a pressure there. It's not recommended to do this in younger children because of damage to the organs there, but that can happen. But certainly in an adult and an older individual, it can be a benefit.
Thank you for bringing that up, Enid. That's really important. I think that's something people really should be aware of.
Some things you're successful doing that, and when Jess passed, he had ingested English muffin, and it went scattered all the way through his lungs, and it was not successful there. He went into cardiac arrest, and
Certainly, every clinic would have the ability to share with the family that they're teaching basic life support and techniques from that end.
I have a question about nosebleeds. My son has lots of nosebleeds, and we went to an ENT doctor, and he told us to try a humidifier at night. So we run the humidifier every night, and that has decreased his nosebleeds dramatically. And it also has helped his just getting colds.
Yes, I think the value of humidified air and even like saline nebulizers, just some movement of particles and some moisture there, this certainly helps from my own experience in general pediatrics with nosebleeds as a general benefit there. But it's certainly that moisture help is sort of clear the airway a little bit better than the secretions.
I've never had reports of people biting their tongues. I perpetually bite my tongue.
Yeah, and I think that probably gets back to the dystonia aspect there and the control of swallowing and the muscles of mastication from there. Yeah, so.
Children must be very painful. I know how to regulate myself, but kids, I don't want to go.
This is probably perhaps more a question for Mark. Is there any more? My son uses one of the Alzheimer's drugs to help with the dementia. Is there evidence of other patients being prescribed such medication, as memantine, for instance? And I know that one or two others have used it for behavioural problems.
Well, as you know, Susan, nobody has studied it in a systematic fashion, so we only have anecdotal reports. I don't think it's unreasonable to try those drugs as symptomatic treatment. They do have potential adverse effects, of course, but I think in terms of symptomatic treatment, it's very reasonable to try those. But I think one of the things we need to try to do in that situation is to decide in advance if we're going to give a trial of a therapy like that, how we'll assess if it's helping, or how we'll decide it's available. I think that's a useful thing to do. It's hard to get people to do it in clinical practice. It applies in another important area, which we didn't mention before, which is seizure management, which is a manifestation of cortical disease in PXE. This is a constant problem we have in child neurology. We see a lot of children whose seizures can't be readily controlled. They end up on 5 or 6 drugs, which are probably having a negative effect. Part of the reason is no one decides before they add a drug how they're going to decide if it's helping or not. And so I think that's an important principle we ought to try to follow in this situation and try to have something to measure. It doesn't have to be an elaborate investigation, but even to decide in terms of practical things, in terms of how somebody's functioning. Can they rest themselves? Can they remember where they put things and so on? You could easily devise something along those lines. I think. So, I have heard one or two other anecdotal reports of that, but we don't. Again, the likelihood we're ever going to be able to do controlled trials of these sorts of therapies in PXE will be very small. But I think essentially what we then do is N-of-1 trials. So you're doing a study on an individual child, but you try to control it and you decide in advance how you're going to assess benefit, because all of these drugs do have potential risks. So that would be my recommendation.
I have 2 questions, one for Julian and one for Dr. Patterson. The anti-reflux therapy, is that like Xanax or something?
Yeah, so ranitidine, antacids, H2 blockers, there are some motility agents as well that can be used. And first of all, the thickening of the feed, various products out there that can help weight it down so it minimize the chance of that. And then the positioning and feeding and aspects like that are all important.
Is there like a anti-reflux diet or